Exercise 22, this deals with the cardiovascular physiology. In other words, we're going to be looking at blood pressure and pulse. So blood pressure, that's how much pressure the blood itself is exerting or pushing against the inside wall of the blood vessels. You have to have a certain amount of pressure there to allow the blood to continue to flow all the way from the heart, through all the blood vessels and back to the heart again. There is what we call a pressure gradient, meaning the pressure within the blood vessels is not the same. It varies depending on where you are in the body, what type of vessel you're looking at. As the blood vessel decreases its distance from the heart, it tends to increase. In other words, the pressure is highest in the arteries as the blood is just leaving the heart. As it continues through the arteries to the arterioles, down to the capillaries, that pressure is decreasing. And then the pressure is lowest in the veins as it's finally returning to the heart. And in previous slides, when we looked at the anatomy, you saw a difference in the thickness of the muscle of the blood vessels to deal with this change in the pressure. When we measure the pressure, which we can do, we refer to systolic and diastolic pressures. Systolic is the pressure when the ventricles are contracting, and diastolic is when those ventricles are relaxing, so diastolic should be lower. The way we would word it is, you've often heard, like a blood pressure is 120 over 80. The 120 would be the systolic pressure, and the diastolic is the 80. This diagram is showing what's happening actually in the heart itself during the contractions versus relaxation and the pressure that you're measuring. So the diastolic pressure is when the ventricles are relaxing. If you look at a cardiac cycle, initially the AV valves, the tricuspid and the bicuspid, those valves between the atriums and the ventricles, are open. So blood in the atrium is flowing down into the ventricles. Now at this point in time, the semilunar valves are closed. That's between the ventricles and the pulmonary trunk and the aorta. Those valves are closed, and that's allowing the ventricles to be filling up with blood. So as you can see, the ventricles are filling up with blood. The force, as it fills up, eventually is going to trigger both the tricuspid and bicuspid to close. So right now in step 2, initially, all the valves are closed. This is preventing backflow of blood from the ventricles from backflowing into the atriums. That increased pressure is then going to trigger the semilunar valves to open. And that's when the ventricle is going to contract, and it's going to open the semilunar valves, pushing the blood from the right ventricle up to the pulmonary trunk and from the left ventricle to the aorta. So at this point now, the ventricles are contracting. Not all the blood completely drains out of the ventricles. Remember, there's always a little bit that will remain in there. The semilunar valves will close, preventing backflow from those arteries from backflowing into the ventricles. Once again, momentarily, all 4 valves are closed. Then the AV valves, as the atriums are filling up with blood, that pressure will trigger the AV valves to open, thereby now having the blood drain into the ventricles, and you're back to step 1 again. Like I said, the normal range for blood pressure for systolic is typically, they prefer it around 120 to 110, but if it's up around 130 to 140, you're borderline high blood pressure. And then for diastolic, they prefer it to be around 70 to 80. Low blood pressure or hypotension, this is when the systolic is below 100. This happens sometimes when people have an infection, when they're sick. If it's too low, you need to be very careful because it can be a sign that the individual is going into shock. Hypertension, which is high blood pressure, is when sustained, the blood pressure is 104, over 140 over 90. Um, and that needs to be taken seriously as a warning. There may be what we refer to typically as peripheral resistance, could mean you have buildup of plaque in the arteries. Um, and unfortunately, hypertension often does not show any outward signs or symptoms, so a lot of people do not even realize that they have it.